In other health news, it's a scenario that doctors have long feared as the national conversation continues around staffing shortages and long wait times in hospitals across the country. A review is underway this morning after a patient died in an ER waiting room in Fredericton. The hospital has confirmed an unexpected patient death took place, but a witness has spoken with CBC News saying the senior died alone in a wheelchair while waiting for care. Hilary Johnstone has been tracking the story for us all morning and joins us once again. She's in Ottawa. Hilary, what do we know about what happened?
Well, John, this witness who spoke with CBC said that for him it was really a surreal moment because he observed an older man who was clearly in distress, but he was in the waiting room. He was on the threshold of getting help, as this witness describes it. But he could tell that this person was in pain. He was groaning. At one point, he thought that this person had fallen asleep, but then an attendant came out into that waiting room area to start checking on people. And according to the witness, this is what happened next.
An attendant come out and check people, and when they checked this one individual, very professionally rushed back so as not to cause any alarm, I assume, and came out with 3 people, and they wheeled the individual out back. And as they were wheeling that person back, they called a code blue. So that individual actually sat there in the waiting room and passed away.
So, John, there are still a lot of details here that we don't have yet. We have heard from the hospital network here called Horizon Health Network apologizing for this or expressing their sympathies for the family, confirming that an unexpected death has occurred and saying that it is going to be reviewing this, that it does this anytime that there's an unexpected death. And this case is no different, saying that it's immediately started the review process. Now, the health minister in New Brunswick has also asked for a full explanation of what happened here. The opposition, meanwhile, calling on that health minister to resign and also calling on the government to explain in detail how it's going to fix the province's healthcare system so that this sort of thing doesn't happen again.
Hilary, this is, of course, not the first time that we're discussing the strain on emergency departments across this country. As we try to understand what is a very complex issue, let's talk about some of the possible causes for these wait times.
It's a complex issue, and experts say that part of the reason for that is because some of this is because of the pandemic. Some of it isn't as well. Some of this predates the pandemic, the issues that the healthcare system had, whether it be hallway medicine, so people being treated in hallways, for example, because there aren't enough beds. But we've been hearing stories from across the country, from Victoria, from the Vancouver Island, of course, all the way to the other coast of this country, about hospitals that are having to cut back the times that their emergency rooms are open. We've heard this in smaller communities, and we've heard it in larger ones as well. In terms of the causes, this is what one Toronto ER doctor told us. Take a listen.
A higher volume, COVID and non-COVID. Remember, people still have other illnesses. People still have medical conditions that have been on the back burner for the past 2 years during this pandemic. There's a lot of difficulty in accessing healthcare through your primary care doctors. So we're just seeing a lot come through our emergency room doors with far fewer resources to deal with, and it's extremely challenging. The nursing shortage is probably the biggest impact in terms of dealing with the quantity of patients along with the quality of care.
And of course, John, we've also been hearing about family doctors and just how many people in this country do not have a family doctor. According to some experts, that could also help as well, that people might go to their family doctor first before going to an emergency room, for example. And on that note, the most recent figures we have from Ontario, for example, show that on average, the month of May, people who needed to be admitted to the hospital waited in ER waiting rooms for an average of 20 hours.
Hilary, thanks for this. Hilary Johnstone in Ottawa.